Welcome to episode 2 of Virtual MLB Baseball Conference, Developing Evidence-Based Interval Throwing Programs, basically the science of throwing. Our 3 speakers today are going to be Glenn Fleisig from ASMI, Christopher Camp from the Minnesota Twins, and Brian Stoneberg from the Los Angeles Dodgers. Couple things I just want to go over quickly. We did get 500 registrations. Which is our capacity. We couldn't fit any more people in the virtual room. We had 400 registrations the first day, and that was great. Wow, very impressive. But we're at capacity, so after this episode, we are going to increase to 1,000. And because we have increased capacity, I've gotten a lot of calls from college ATCs and medical staffs asking if they could join this. After talking with several of the people, we decided to go ahead and invite them, but this is still specifically for MLB departments, so you'll be invited first so you can register, but I don't think it's going to be a problem with a capacity of 1,000. There's been a lot of questions about CEUs, so as long as you're at the course and registered, and that includes the audio call-ins, you will get CEUs. They've been approved by the NATA and the NSCA, and you'll receive certificates at the end of the series, not after each one. So if we have 5 programs, 5 episodes, you'll get two CEUs per 10 CEUs altogether. PTs are a little bit different category because each state is different in regards to their CEUs. You will get certificates, and you'll need to submit those to your particular state. If you have any questions about that, Nancy Flynn has got all the answers. That's her email address. Just drop her a note, and she'll make sure you're going to get all these things. The poll that will be activated near the end of the conference today was very, very educational for us, and we really appreciate you participating in that. It told us what you guys wanted, and one of the things that we saw right away was an increased time for the speaker's presentation. That people felt that was too short, so we've increased that for these speakers, so they'll be able to go longer in their presentations. So this week, there's only 6 questions that we're asking you because most of those were redundant. The Survey Monkey is very important for us. It is important for the CEUs. When you leave the conference, you'll get a link in your browser to do the survey. Try to do it then if you can. You will get another automatic notice in your email 24 hours after this starts. So you'll get 2 shots at that. It's really important to do this. For the CEUs, they need a documentation in case we're audited, so that'll be an issue. As far as the Q&A, we're going to do it the same way we did it last time with raise your hands, but we're also going to activate the Q&A on the bottom of your screen so that you can put in questions to the speakers. Even as they're doing that, we'll still wait to the end to do the question and answers. We'd rather use the Q&A than the chat, just so we go one thing. Nancy Flynn will be monitoring that, so we can do that. But if you want to raise your hand and do that way, please do that. I think it's important to ask questions. Don't be afraid. Just go out there and ask these experts on what we want to do. So getting into this thing, one of the things I was thinking about was years ago, I was watching a sportscast, and they were talking about all the shoulder injuries in Major League Baseball. And they said, throwing is not a natural act. I thought, I don't believe that. I think it's a natural act, but I don't know if I had any proof on that. So I actually went back and I looked at some archaeology literature. And you have this Darwin quote from 1874, apes are quite unable, as myself has seen, to throw a stone with precision. And you can see in this case, this is a little bit more run and gun, more run than gun. But compared with other carnivores, humans are slow, weak, lack natural weapons such as fangs and claws, although I've run into a few humans with claws. However, humans were eating meat at about 2.6 million years ago and probably hunting larger prey than themselves about 1.9 million years ago. This is based on an article by Roach. So archaeologists have hypothesized that the human brain needed meat and protein to develop. So in order to get this, they needed weapons to take down large animals, typically using spears to increase the distance between getting supper and being supper. So throwing is thought to originate in the Homo erectus or Neanderthal time frames. And fossils, especially human skeletons, showed asymmetry in these humans over 500,000 years ago. And of course, that was humeral retroversion from throwing. So when you compare apes to humans, there are three important changes as it relates to throwing. One is expansion of the waist to allow separation of upper extremity to the lower extremities. Well, we talk about hip, shoulder, hip separation in all types of mechanics. The ability to achieve maximal external rotation, stored energy in the kinetic chain in the cocking phase, humeral retroversion. Lowering of the shoulder with decrease in size of the greater tuberosity and positioning of the scapula. All of this was found and remains over almost 2 million years ago. So when you look at the chimpanzee versus human, one of the things is that the chimpanzee can get his hands over his head, but he can't get in the 90-90 position because of the angle of the origin and insertion of the pec, as well as some other issues. So we're able to get in that 90-90 position. And these two pictures really show humeral retroversion, which I don't think we need to get into, but also the line of the pec in the chimpanzee and the human, as well as the scapula. We know how important the scapula is at throwing, and you see the differences in this with the inclination of the glenoid in regards to the chimpanzee versus the human in order to get more external rotation. In addition, over years of looking at all this stuff, we saw the evolution of the greater tuberosity lowering and getting smaller. And you can see this as they talk about different evolutions in that shoulder, A to D. And of course, by lowering that and making the greater tuberosity smaller, you are able to obtain more external rotation and able to get to what we see as throwing, and to be able, for someone like this to be able to do what he does. Okay, so we're going to get really to our first speaker here after that little impromptu thing. Glenn Fleisig will be our first speaker. He is me talking on the biomechanics of interval throwing. Glenn got his bachelor's in mechanical engineering at MIT in 1984 and served as a research intern for the USOC in 1984. He got his master's in mechanical engineering at Washington University in St. Louis in 1987, and his PhD in biomedical engineering at University of Alabama, Birmingham in 1999. And then he was offered this job with this startup called ASMI, and he's done pretty well with that. In addition to all of that, he's an adjunct professor at the Department of Biomedical Engineering, University of Alabama, Birmingham. He's a fellow in the International Society of Biomechanics and Sports Medicine, chair of the USA Baseball Medical and Safety Committee, a pitching safety consultant in Little League and baseball and softball, and he's an injury research advisor for Major League Baseball. Numerous publications to mention. Much of the epidemiological work was focused on elbow and shoulder. His committee work with Little League Baseball, USA, Major League Baseball, SMART program has really led to the really big changes in regulations and guidelines for pitch counts. His family, daughters Julia and Emily, and his wife Clara. Glenn?
Okay. Thanks, Stan. Okay, that's very nice. Yeah, so I'm going to switch my style. You were talking about 2 million years ago. I'm going to go more a Star Wars style here. Let's do this. Let's pose this over here. Whoops. There we go. Okay, and there. Okay, I hope everyone can see that. And So thanks for inviting me to episode number 2. Episode 2, Interval Throwing Program. Not long ago, in a time to stay far, far away, Stan Conte created a virtual conference for MLB. After a successful inaugural episode, this week we'll focus on interval throwing programs. I'll start with talking about the biomechanics. Then Dr. Christopher Camp will present monitoring and optimizing. And this will be followed by Brian Stoneberg talking about preparing the arm and body for interval throwing program. So let me get back to normal things here. Okay, interval throwing program. So the interval throwing programs vary, but they all typically have long toss elements where you throw anywhere from 45 feet to typically about 150 feet on flat ground. And then they also have a progression on the mound of progressing from about half effort to 3/4 effort to 100% effort. And again, Kevin Wilk at our center, I guess, wrote the first interval throwing program in the different versions. But I think these are the two main aspects of the interval throwing program, what we'll be talking about today. And I noticed in the instructions for all the interval throwing programs, they always say things like use proper mechanics or use your mechanics. And also, so we did some studies, which I'm about to present here, about whether doing a long toss and whether pitching from a mound with partial effort really is possible, or whether you really do use proper mechanics, or pitching mechanics.
Hey, Dr. Fleisig, sorry to interrupt. Do you mind doing your headphones? It's just a little bit choppy.
Let me, thanks.
No, thank you.
Okay, is that better, Nancy?
Yes, much better. Thank you.
Okay, sorry. All right, anyway, what I was saying was long toss typically has flat ground throws, and it also has a progression of pitching on the mound from half effort to full effort. And the instructions for these programs say do the long toss and the partial effort pitching, use proper pitching mechanics. So we did some studies to see whether that's even possible and whether that really happens. Let me move this here. Whoops. Okay. I'm just trying to figure out the Zoom thing here. Anyway, we did a study in 2011 where we looked at 17 collegiate pitchers. And we had them come into the biomechanics lab on one day, one at a time. And we put the reflective markers on them. And we had them pitch from the mound in our lab. Here you see the reflective markers being placed on them. And on a different day, we had them go out to the ball field, and we brought our whole motion analysis system out there, as you can see, and we had them warm up. We had them come in pairs so that they could practice long toss with each other. And you can see them doing a crow hop throw there, and the data is captured. We had them throw 5 throws as hard as they can on a line, 120 feet, 180 feet, and then 5 throws maximum distance. You see that maximum distance throw, we allowed them to throw with an R. Try to do this here. Okay, and here are the results from that study. So when we had them throw, I'm going to try to move this thing here. There. When they had them throw pitching or the long toss, 120, 180, or maximum distance, the maximum distance for these college pitchers was about 275 feet. You can see here that the upper trunk, shown here, was most, let's say, uphill for the maximum distance throws. And the knee had the least flexion for the maximum distance throws. So although we said use proper pitching mechanics, you can see some differences there. Interestingly, the foot position also changed. Let me move this camera here. Whoops. The foot position also changed. We measured how many centimeters or inches they are to the closed side. And it was about 25 centimeters or 10 inches in normal pitching, but as they started throwing longer and longer, they started stepping less and less closed. And at ball release, the trunk was less tilted forward for the maximum distance throws, and the knee had the least flexion. But what's happening at the shoulder and at the elbow? Well, at the shoulder, you could see we measure maximum external rotation. Here is the pitcher, and he had about 174 degrees of external rotation of the arm compared to the trunk. And when we got to longer distance, especially that maximum distance throws, it was even more external rotation. And the internal rotation torque at the shoulder to stop the arm from going back and get it going forward went higher in the longer throws. So at 120 feet, it was about the same as pitching. But as the distances increased, you can see at the maximum distance, it was even more torque. And similarly, at the elbow, we see a different range of motion. We see for the maximum effort throw, there is more elbow flexion. And then from this position, there's a more elbow extension velocity for the farther throws. As far as varus torque goes, which of course is the one that's related to Tommy John injuries, UCL injuries, the varus torque right here on the elbow was greatest for the maximum distance throws. So these throws are, let's say, more stressful than actually pitching. A couple of years later, there was a study by Nicholas Slinker and his colleagues. They did a similar study. They did college pitchers, and they went out to the ball field, and you can see they brought their mound out there, and they just did it all in one day. They had their motion analysis cameras like we did, and then they had them pitch, or they had them throw certain distances. You see these cones in the distance. They had them pitch from the mound. They had them do long toss. Like our study, they instructed them to throw every throw as hard as they can on a straight line with the crow hop with full effort. Then they had them do partial effort pitching, and I'll show the results for that in a second. Even though they used a full motion capture system, they only reported the ball velocity and the elbow and shoulder torques. So that's obviously what I'll present here because that's all they reported. You can see here that even though they told their pitchers to pitch with or to throw with full effort on all throws, in their study, somehow they threw 74 miles per hour, but for the longer throws, the longer they threw, they reported less ball velocity. So I'm a little skeptical about interpreting the results here about whether these were really full effort throws or kind of lobs. I don't know. But the instructions in the article said they said full effort. And also, see, their torques were less in the farther throws for the elbow and shoulder. But again, the ball velocity was less. So I don't put as much weight on this study as our previous study. But what I did like about this study by Slinker is that they also did partial effort pitching. So again, they went on the pitching mound. They instructed the pitchers to throw some pitches at 100% effort, 80% effort, and 60% effort. And as you can see here, the ball velocities went down. This was not exactly 60% of that, but it was less. And you can see velocity goes down with effort. Same with torque. At the elbow and the shoulder, the torque was less for the partial effort throws. Now, again, these are Newton meters and miles per hour. So what I did was I divided all these numbers by the 100% number to see whether the 80% effort pitch was 80% velocity and 80% torque, etc. And when you do that, I get these numbers. That the ball velocity, when you throw 80% effort, is really about 90% of your full effort velocity. And when you throw 60% effort, it's about 85% ball velocity. So you can't really use a radar gun to measure effort, essentially. As far as the torque goes, it's important to know that a 60% effort throw is about 78% torque. So it's not 60% of the torque. And likewise, 80% torque and 80% effort pitches had about 80 to 90% of torque. Turns out we did a study like this back in 1996. This is a picture. I started ASMI back in 1987. And this is a picture of a study we did in 1996. And we used 27 collegiate pitchers. And we didn't put it in a journal. It's just in this proceedings. And I could send it to anybody if anybody asks me afterwards. But we had 27 pitchers. We did the full motion analysis get-up. We used a radar gun. And we had them throw it half effort, 3/4 effort, and 100% effort. And just scaling it, what we found was this, that when you threw at half effort, it was about 85% of the ball velocity. 3/4 effort was 90% effort ball velocity. And the torques also were a little higher. 75% effort was 85% torque, and 50% effort was 75% torque. not to get into this too much, but there were mechanical differences also. When you throw with reduced effort, you have more horizontal adduction, you stick your elbow out more, and you get less external rotation and knee flexion. More recently than 1996, there's this study, which just came out by Eric Mockney and his group, Vinny Lizio. And they looked at partial effort pitching as well. They had 37 high school and college pitchers, and instead of using the full motion analysis system that we use in all of our studies, what they did was they used this motor sleeve, as most of you are familiar with. The motor sleeve is shown here, and here is a sleeve with a little sensor, IMU it's called, an inertial measurement unit that goes in there and can measure, can calculate the torque. So using this study, they had these pitchers throw different efforts, and they recorded the velocity and torque. And they also found similar numbers. And so what I'm going to do is, there's a lot of numbers here, I know. So what I did was I made this graph here, and I think this shows it best. This is the percent effort of pitching on the bottom, and this is the actual ball velocity on the side, on the vertical. And these are the different studies. And you can see if actual effort and ball velocity were the same, then a 100%, a 50% effort throw would have 50% velocity, 75% would have 75% velocity, etc. This gray line. But what you see is all three studies were very similar, where you can see here, something to just put in your mind, that a 50% effort is really more like 80% ball velocity. 75% effort is more like 85, 90% ball velocity. As far as the torque, let's just focus on the elbow for a second. And you see again, 50% effort throw is not 50% torque. It's more like 75% torque. And then a 3/4 effort throw is more like 90% of the torque. Okay, I have some bonus research to show before we go to the next speakers. And even though talking about pitching, throwing distances on the long toss, I want to talk about a couple of studies we just published about other effects on pitching. In fact, we took a look at what would happen if the pitching mound were lowered, and we took a look at what happens if the pitching mound is moved back. I know in some rehab situations, we actually have some pitchers do rehab on lower mounds on the concept that it's less stressful. But really, both these studies were sponsored by Major League Baseball. And the reason they did them, first this study, then that study, is they were looking at possible ways to get more offense in the game of baseball, and to check biomechanically if it would be safe if Major League Baseball decides to lower the mound or move the mound farther back. So I just want to share with you a couple of these. I shared this one at the winter meetings last December in our pre-coronavirus life when we were all together. And this was done over what we did was we had Major League Baseball, ASMI, USA Baseball, and Modus all work together. And here's the team who worked on the study. And what we did was we flew out to the USA Baseball complex in Cary, North Carolina, and we set up this tent behind the home run fence. And what we did in the tent is we had Major League Baseball build 4 mounds, a standard 10-inch mound, an higher 12-inch mound, and two lower mounds, a 6-inch mound and an 8-inch high mound. And then, of course, they all had 60 feet 6 inches to the home plate. And so here's what it looked like. These were mounds, again, constructed by Major League Baseball, and we had 2 motion analysis systems. So we could have one pitcher being tested here, one pitcher being tested over here, 2 different motion analysis systems here, and we could collect each pitcher, testing in all 4 conditions. We also, besides measuring the pitching mechanics, we looked at the ball movement, and we used a Rapsodo system, which is shown here. We also let the pitchers choose whether they wanted to throw to a catcher or throw to a target, and so either one was available. But in either case, we tracked the ball with the Rapsodo. And like I said, we had 6, 8, 10, and 12-inch mounds. We also had them throw fastballs and curveballs to see how the ball moves and how the mound height affects both. And what we found was the following. We found that the torque on the elbow, again, related to UCL, was about 90 Newton meters. And at the higher mounds, on the standard mound, but on the lower mounds, it was a little less torque. And same with the other forces and torques, that if we look at 10-inch mound as a standard mound, raising the mound had about the same torque, but the lower mounds had, you know, slightly less torque in the fastballs. There was no difference in the curveball. There were several kinematic differences, certain mechanical differences, but they're really not worth getting into because most of them, as you can see, if you look at these numbers, it's like 43 or 44, 93, 92. It's like a difference of 1 degree. So the mechanics were slightly adjusted with the different mounds, but I don't really think it's that important. And curveball also found different mechanics, slightly statistically significant, but I don't know if it's practically relevant. Then with the Rapsodo system, we found no difference in ball velocity for the different mound heights. So it's not like the higher mound to get more velocity. We didn't see that. And also, we didn't see any difference in the ball breaks in the fastballs or the curveballs relative to mound height. And, you know, you think, oh, from a higher mound or lower mound would make a difference. But we're talking about an inch or two of height 60 feet away. So really, the angle it's coming in didn't really have an effect on the curving, on the break of the ball. The other one, which was the more recent study, we looked at what would happen if we moved the pitching mound back. Of course, standard is 60 feet 6 inches. We had this done in our lab, and we used the motion analysis. We used pitch FX this time to measure the ball motion. We did the standard 60 feet 6 inch distance, and then we did 62 feet 6 inches. This was a suggestion or request by Major League Baseball to check that out. And then I don't know if anyone could figure this out, but 63 feet 8 inches seems like a weird number. But what that is how far the pitching rubber would be from home plate if the pitching rubber was exactly between first base and third base. So anyway, what we did was we didn't keep lifting the pitching mound. What we did was we just had the catcher scooch back, and we kept moving home plate to different locations that we had measured out. And we had the pitcher in a random order pitch the different distances. All of that set up to say that we found no differences, that there was no difference in the motions or in the forces for throwing a different distance, and there was no difference in the ball velocity. There was a difference in how long it took the ball to reach home plate from the pitching mound. As you moved the mound farther back, it took a fraction of a second longer. And also, there was more vertical and horizontal break of the pitches the more the distance was increased. So in conclusion, again, the instructions, and we're going to talk about it with the next two speakers, that in interval throwing, you're trying to use proper mechanics, and that's the instructions. And what we see is in the long toss, there are mechanical differences when throwing different lengths. They are measurable differences in trunk angle and arm angles with different distances. And the kinetics are changed. In fact, the kinetics are significantly greater than pitching when you're doing long toss farther than 150 feet, I would say. So I would say that, and again, these are the kinetics when throwing with full effort on a straight line. And what I would say is, I think this shows that the kinetics are safe for rehab from 150 feet or less. And I would avoid, based on these data sets, I would avoid long toss greater than 150 feet in a rehab setting. Now, I'm not saying in a healthy baseball players in strength and conditioning. I'm saying that when you throw greater than 150 feet, you are putting your arm into more external rotation, and you're creating more torque on your elbow and shoulder than normal pitching. Do you want to do that in a rehab setting? I don't think so. Do you want to do that in a strength and conditioning? I don't know. I'm just saying this is what happens, and it's your decision, knowing this information, about whether you want to have some exercises that are actually more stressful than pitching. The joint velocities were also the greatest in the long distance throws. Pitching from a mound, the mechanical differences we notice with the different partial effort, you change your arm motion a little bit. And I think if you want to just take a mental picture or whatever, if you tell pitchers to throw at 75% effort, to pitch at 75% effort, the radar gun will show the ball velocity is about 90% of their full effort velocity. And the biomechanics will show that the elbow and shoulder torque is about 85% of the torque of a full effort pitch. And in a half effort pitch, it's actually about 85% of the ball velocity of a full effort pitch and about 75% of the joint kinetics. Again, from lowering the mound, if that were to happen, I don't really think there's a big difference in the mechanics. And lowering the mound is actually a little less stressful than the current mound. So there's really, I don't think it would be dangerous if Major League Baseball decides to lower the mound. However, I didn't see any performance changes such as different velocities or different breaks. So I don't know what the value would be, but I don't think it would be dangerous. As far as if Major League Baseball decides to increase the pitching distance, again, it looks like the mechanics are pretty safe or pretty similar. And but would it have the effect of making more offense in baseball? Well, it would. You know, pitchers are throwing 100 miles per hour. People like me throw 100 miles per hour, of course. But it would give batters a little more time for today's faster pitchers. But the pitches would also break a little more. So it's not obvious that increasing the pitching distance would actually help the hitters. It will give them more time, but the balls would be breaking more. So who knows? Okay, with that, I'm going to turn it back over to you, Stan, and we'll go on to the next speaker.
Great, Glenn. Excellent. Really excellent. We're going to introduce the next speaker. Sorry. Christopher Camp. He'll be talking on monitoring and optimizing long toss and mound progression. His education is BS from Lee University, Mayo Clinic, his MD work as resident at Mayo Clinic as well, and was a research fellow, and that's actually where I met him when he was at HSS on a 2-year fellowship, one on research and one on clinical, and he did his clinical fellowship at HSS. Just a personal note from my standpoint, I met Christopher when he was at HSS, and he was looking to help MLB, and I was fortunate enough to team up with him, and he and I have done a lot of studies. I should say he did a lot of studies, and I hung on for dear life. But he has done a tremendous amount of publishing in the last 3 or 4 years, and is now the Minnesota Twins team physician. There's his focus in regards to orthopedic education, and this is him and his wife, Erica, and their children, Annabelle, Bennett, Emmeline, and Warren. So all yours, Chris.
All right, thank you. I'll get it pulled up here. All right, you guys hear me okay?
Yes.
All right. Well, thanks for the introduction, Stan, and thanks for setting the stage, Glenn. So next little bit, we're going to talk sort of about monitoring and optimizing long toss and mound progression. So Glenn went through a lot of this. Fortunately, he sent me his slides ahead of time, so I was able to sort of comb out some of the stuff that he already talked about. So I'm going to try to give you all new data in here. It'll seem similar, but I think it should be new and different. Here's a brief outline of the things we're going to do. So when I put a talk together like this, I always like to think, what are the questions we can actually answer and walk away with some meaningful information on? And so the first question, I think this one's the easiest. We can all probably discuss and agree. Why do we use interval throwing programs, long toss and mound progressions? Next, how are they designed and what's wrong with them? What are some of the flaws? How do we monitor and measure them? And then lastly, what should we be doing better? And I'll be honest with you, I think I have pretty decent evidence for the first three. The last one, I put an asterisk by that. I don't have a lot of evidence for it, but I'm going to give you my thoughts. And I think a lot of you guys are thinking some similar things. So hopefully that's something we can work together and figure out. So our first question, why do we use these programs? You guys know there's a lot of reasons. So ultimately, if you got somebody returning from the off season or a period of long rest, recovering from injury, trying to improve arm strength, increase velocity, injury prevention, and there's a number of other reasons. But I think sometimes we can sort of get lost in this, and we have to remember the real purpose for all of these are to get these guys ready for game activity. I think sometimes we get a little bit lost in the minutia, counting throws and measuring distances and velocity and everything else, and we lose sight of the prize, and that's ultimately getting people ready for game activity. And so I think that anytime we start talking about this, we can't lose sight of that ultimate goal. So our second question, how are they designed and what's wrong with them? And you guys know this, I'm not telling you anything new here, but the basic premise of all interval throwing progressions is there's a steadily increasing number of throws thrown at increasing distances with increasing amounts of effort. Everybody sort of has their own little take and flavor and twist on this, but that's the basic premise of all throwing programs if you want to break them down into their simplest form. Now, sometimes we like to get fancy and we talk about acute chronic workload ratios, periods of deloading, ways to vary the stress, either weighted balls, pull downs, those different sorts of things. And Stan has some episodes coming up that are going to focus on some of those more advanced options. So today I'm going to sort of stick mostly with the basic design. So we'll talk about this. And what are the inherent problems with this? Well, I'll say one, if you base this just on a general numbers of throws and distances and effort, it ultimately ends up giving us a little bit of a one size fits all approach. And so, you can see these two guys here, one of them 7 foot, the other's 5'8". They play different positions. Clearly they have different demands, different throwing mechanisms or characteristics and mechanics, different goals. And imagine, they're both professional baseball players. What about the high school or the college kid? So there is some danger. Not all throwers are the same and their goals aren't the same. But if we want to figure out how they're different, well, we need to look at it scientifically. So one question we have to ask ourselves are our throwers consistent within themselves? Meaning, if I have a guy that goes out and throws long toss at 120 feet and makes 5 throws at 120 feet, how similar are each of those throws? Or are they each unique and different? That's the easier question. And then the harder question is, well, are they consistent compared to one another? Meaning, does thrower A and thrower B, if they do the same long toss program, are they going to experience the same stress and effort and energy? And I think we have to know the answer to those questions before we try to design an appropriate program. So this is a study that we published in conjunction with a lot of people. Glenn and Stan were both involved in this, sort of looking at variability in throwing metrics during structured long toss. We used 60 healthy high school college pitchers. They went through a throwing progression. They threw long toss at 90 feet, 120, 150, 180, and then they got on the mound and threw max effort fastballs. We measured a number of metrics that you can see here. And then we wanted to assess the intra-thrower variability and inter-thrower variability. So first, to start with the intra-thrower reliability. So that means how consistent were all of our throwers with themselves? So if I go out and I throw 5 throws at 90 feet, do all 5 of those throws look the same or are they different? That's the question we were asked there. And to do this, we calculated interclass correlation coefficients. And fortunately, all ICCs were greater than 0.75, which suggests excellent agreement. So that was true of all throwers at all distances and scenarios. So that's good news. So that means, generally speaking, one player's throws from a given distance with the same set of instructions tend to be similar within that one player. However, we did see a couple of trends that are worth noting. So one, that player's variability in their torque increased as they move through the interval throwing progression. That doesn't mean the torque necessarily increased, but it means the variation in their torque increased. So at short distances, you can see that variability was low. As they got out to 180 feet in mound throwing, the variation was a little bit higher. And then for velocity, we saw the opposite. The variability actually decreased as they got out to longer distances and they got on the mound. So ball velocity tend to be more varied at shorter distances, and torque was the opposite. So it's another thing that shows Yeah, they do generally correlate well with one another, but they're not perfect. So be careful when using a radar gun as an estimate of torque. All right, so now moving on to inter-thrower reliability. So if I have thrower A and I want to compare him to thrower B, and I've given both the same instructions, how similar are their throws going to be? This is a little bit tougher to look at, but I'm going to walk you guys through this. So first, if we look at elbow torque, each of these graphs represents all the players in the different throwing scenarios. You see each graph has 60 dots on it. Each one of those represents a player, and that is that player's throws in comparison to all the other throwers. So ideally, you want a CV, which is a coefficient of variability, less than 5. If it's less than 5, that means that that player's elbow torque was similar to all the other guys for that throwing scenario. So what we see is there's a lot of dots above that number 5 cutoff. Overall, 79% of pitchers had acceptable inter-throw reliability, meaning they had a CV of less than 5 for elbow torque. However, 21% were considered outliers, meaning you should not be applying standard metrics to 21% of your throwers because they're very unique. And it probably has to do with their delivery, their mechanics, and a lot of other things, but they don't fit the mold. And if you look at each of these graphs on the right, pay attention to the one at the bottom for the mound throwing. You'll see that's the one where we saw the greatest variability. So there's a lot of dots that are well above 5 on that graph. All right, so that's elbow torque. Now let's move to ball velocity. Again, same set of graphs, all the throwing scenarios, all the throwers are represented. Here you can see those numbers are clustered closer to the bottom much more consistently. So ultimately, 91% of pitchers had acceptable inter-throw reliability compared to their peers, and only 9% were outliers in terms of velocity. And I'll draw your attention to that graph at the bottom for the mound. If you see there, 100% of the pitchers had acceptable variability, very low variability for mound throwing. So that would suggest that elbow torque is the most variable with mound throwing. Ball velocity is the least variable with mound throwing. So that suggests that radar guns may not always be the best surrogate for elbow torque, particularly when they're on the mound. So something to be aware of and be careful about. All right, so now let's see if we can answer our questions. Are all throws the same? No, we all knew that. Are they consistent within themselves? Yes, for the most part. There's some trends towards change, but overall, if you tell a guy to go make X number of throws at a certain distance under a certain condition, those throws are going to be relatively consistent. However, what about when you compare them to others? No, about 21% of throwers are clear outliers, at least in terms of elbow torque. And maybe that doesn't matter if you have somebody who's just coming back from or just starting spring training or just come back from period of rest, but I think that's probably pretty significant in the rehab setting. So something to be mindful of. These players probably need to have individualized programs. All right, so now let's talk a little bit about reduced effort throwing. And if you guys are wondering, this is actually a picture of Glenn and myself arm wrestling over who would get to give the first talk today. So I'll let you figure out who's who there, but you saw who got to give the first talk. So for reduced effort throwing, Glenn talked about this on the mound. I'm going to talk about it in long toss. So what happens when you tell a player to reduce their effort and throw at 75%? Or what about 50%? And what Glenn told us is a little bit concerning. So that gives you the idea. Is it even worth telling players to do this? It's so inaccurate. Maybe we shouldn't be doing it. So we looked at this question during long toss. So again, the data Glenn presented to you was off a mound. This is long toss because many interval throwing programs have a long toss component that also requires reduced effort. The title of the paper sort of gives it away, but 60 healthy pitchers, once again, we had them throw long toss 120 feet on a line, 100% effort, 75% effort, and then 50% effort, 5 throws at each. Again, we measured a lot of different throwing metrics, and then we compared all of these metrics at all levels of effort. This is similar to the graph that Glenn showed you, but it's in a reverse direction. So if we start out at 100% effort up at the upper left, and then we have them reduced down to 75 and 50, you should see if the metrics reduce by 25 and 50%, they should follow that line. So that's sort of the idealized line. Here's what we found. The good news with this actually was that shoulder rotation and arm slot stayed the same. So that's good news, I think. So if you tell somebody to throw with reduced effort, they tend not to change their shoulder rotation and arm slot. I think we would all agree those are pretty good things. However, some things did reduce. Elbow torque, ball velocity, fingertip velocity, arm speed, all reduced. That's good. I think that's sort of what we're trying to get at with these reduced effort throws. So this reduction was significant. However, it did not drop all the way down to that idealized line. Ultimately, what we found during long toss, for every 25% decrease in effort that you tell the player to do, elbow torque only decreased 7%, and ball velocity only decreased 11%. All right, so getting back to our questions here, what happens at 75% effort? Elbow torque or stress, it reduces, but only to about 93%. At 50% effort, it drops, but only to about 86% effort. So I've heard people read this paper and they say, well, we shouldn't even be doing this. I don't know that that's necessarily the case. I think it's still okay and safe to do reduced effort throws. You just need to know what you're getting. Don't think that you're getting 50% less stress on the elbow or 25% less stress on the elbow. You're actually getting a much smaller change than that. So just be mindful and just be aware of that. Now I'm going to talk a little bit about how to monitor and measure these throwing programs as well. So there's really 5 main ways, in my opinion, that we can measure interval throwing. 1, direct observation, indirect observation, velocity tracking or radar guns, using wearable technology, or motion capture. Direct observation, I think, is really a cornerstone of interval throwing programs. I think it's critical and it should always be done by somebody, ideally. The benefits of doing this is you can have 2-way immediate feedback. You can talk to the player can talk to you. You can adjust programming in real time. If you see something going on, you can cut them back, you can dial them back, shut them down, do whatever you need to do, or maybe extend them a little bit if things are going better than expected. You can also log and track their progress over time. You actually know that they're doing it if you're sitting there watching them directly. Obviously, the negatives are it's very subjective. Ideally, you need an expert doing this. A lot of us, most of us, don't have the skill set to be able to watch a pitcher throwing live and be able to tell them live what they're doing wrong. But fortunately, we work in professional baseball, and if we can't do it, most of us know somebody who can. Indirect observation. If I was giving this talk 2 months ago, I would not have listed this. But now we have found this to be one of the most effective COVID-compliant methods for monitoring these programs. So get creative. I think nobody has an excuse now. We all know how to use this technology, whether we like it or not. It does allow for multiple observers, so you can have a lot of people watching at one time. But again, the negatives of this are it's very subjective. It's a little bit less personal, but I think it's probably better than nothing. So something to consider when times are tough. And then also radar guns. So this is something that's extremely common. A lot of people like it. A lot of people use it. I'm going to give you a little bit of data on it. So this is from one of the studies that I quoted earlier. If you see what elbow torque does as people progress through mound throwing, you can see elbow torque increases at 90, 120, and 150, and then it sort of levels off around 150, 180 in the mound throwing without much variation. You compare that to ball velocity, and we see some differences again. So elbow torque levels off late in long toss and mound throwing, whereas ball velocity continues to increase. So not saying that you can't do it, just saying to be careful with it. This is the study that Glenn presented from Eric Mackney, looking at reduced effort throws and how the ball velocity and elbow torque correlated with one another. You can see the graph on the right. It shows an ideal correlation of those lines. And you can see the different marks and dots are sort of sprinkled all over, showing that it's a reasonable cluster, but not perfect. This is a study from Glenn looking at fastball velocity and elbow torque in pitchers on a mound. And you can see within this graph, each of those different colored lines represents a different pitcher. And so within a pitcher, those lines correlated well with one another, but pitchers were different from one another. So he concluded that when comparing 2 professional baseball pitchers, high velocity may not indicate higher elbow torque due to confounding effects of specific differences. However, within an individual pitcher, high velocity was strongly associated with elbow bearers torque. So probably safe to use it to compare a thrower to themselves, but not to compare them to somebody else. So some of the pros of this, you get immediate feedback, you get some idea of their effort and workload, but the downside, it doesn't correlate perfectly with the outcome measures we're looking for. You can't compare it between players. And you guys know sometimes players will really get after it when they see a radar gun after them, which may be counterproductive to what you're trying to do. Wearable technology continues to evolve. There's a lot of potential benefits. It is objective. It's becoming more affordable, which may have good implication for lower levels of baseball, little league, high school baseball, those sort of things. It does allow you to monitor metrics remotely. You can pre-program throwing routines and maybe potentially help us get to a workload-based program, which I'll talk about in a minute. Obviously, there's still some concerns over validity. And obviously, as you guys know, if you work with professional baseball, there's players and the union concerns over tracking. Motion capture is what Glenn, world expert in, and presented on. So that's the historic gold standard. It's the most validated and informative. The problem is it's expensive and labor intensive, and sometimes it's hard to get on a baseball field, especially if you want to use it every day. But there are some newer techniques that are emerging. So we have markerless motion capture now, and we now have the ability to capture the pitcher and the ball without using markers. So I think this is something that's going to continue to grow and will be an integral part to all of our throwing programs in the future. All right, now lastly, I'll try to go through this quick. What should we be doing better? In my opinion, really three things. One, we need to start individualizing programs based on workload, force, effort, and energy. So rather than telling a guy, all right, you're going to go out, two guys are at the same stage of throwing, say you're both going to go out and throw 30 throws today. It may be that one guy's mechanics are so sound that those 30 throws, he barely sees any stress on his elbow or shoulder or whatever you're worried about, whereas the other guy is so inefficient that he's seeing increased stress. So it's not fair to punish the efficient thrower and try to rapidly advance the inefficient thrower to bring them both to an average. So if we can individualize programs based on workload and maybe say, rather than throwing 30 pitches, you guys are both going to go out and I want your elbow to see 2,000 Newton meters of stress today. One guy might hit that number after 20 throws. The other might hit it after 40 throws. And so this is something that we need to be thinking about, how we can represent this in individualized programs. Also, we need to identify and validate objective return to play criteria. Think about what we do for a patient or an athlete that has an ACL reconstruction. We don't let them go back to play until they've passed pretty significant functional testing, whether that's Y balance, hop test, time T test, agility, psychologic analysis. There's a ton, and we don't do that for our throwers. And I think that we're to the point now where we have enough data and information that we can and we should develop validated functional outcome testing to know who's safe to return to play. And then lastly, we need to do a better job of leveraging baseline metrics to define our goal. So right now we sort of have a one size fits all, but we know all players' goals are different. And if you think about it, the concept of impact testing for concussion, I think, is very applicable here. So we have people take an impact test before they have a concussion. So we know what their baseline is. Then when they get hit in the head and they have a concussion, we can repeat the test and see how long it takes them to get back to baseline. We should be doing the same thing for our throwers. So imagine a world where we have a healthy pitcher and we get that pitcher's data. So we know all of their kinematics at various long toss distances, their mound throwing, their different pitches is. We know their spin rate, ball velocity, elbow torque, all that sort of thing as a baseline. Then if that pitcher gets injured, they get treatment, surgery, whatever it is, undergo recovery and rehab, we initiate an interval throwing program. And then that program is individualized. It's based on a workload progression that is specific to that player. It is driven by their baseline metrics and data that are specific to them. And we have a clearly defined goal that we are trying to get them back to. Not that we're just trying to get them to where they can throw 7 innings straight in a rehab assignment, but we want to know, what is your velocity? What is your arm slot? What is your release point? All of these different metrics that we're actually trying to get them back to. And then we put them through a formal return to play functional testing protocol to see if they're ready to do that and then get back to pitching. And I think this is sort of what we need to shift to, like we've done. And the ACL is a great example of how we've done some of this in concussion, as I mentioned. That's the model that we need to go to. And potentially, if we do it right, maybe we could help them be better than before and then get out of this cycle of injury, recovery, repeat over and over again. So those are a few thoughts that I think that we really need to be working on the next few years. And I think it's the folks that are on this call watching this video right now that'll be the ones that'll be able to answer it. Thank you very much. That's all I have.
Thank you, Christopher. That was great. Just going to introduce the next speaker. Ryan Stoneberg, known to everybody in baseball as Stoney. minor league strength coach for the Los Angeles Dodgers. He's entering his 9th season, and a graduate of BS in exercise science from ASU. Prior to working the Dodgers, he was Exos performance coach and intern in Phoenix, Arizona. He spent 5 weeks in Beijing, China, working the Chinese Olympic Committee, preparing for the 2012 Summer Olympics, strength and conditioning for the Minnesota AA affiliate for the 2010 season, position strength coach for the Kettlers of the Cape Cod League, certifications and just about everything you can imagine. He resides in Arizona with his wife, Heather, son, Brandon, and his dog, Porter. You're on.
All right. Thank you, Stan and Nancy, and I appreciate you having me on. Following up two really good presentations this week and 3 from last week as well. So let me get this PowerPoint started here. All right, so today I wanted to touch on preparing the arm and body for throwing progression, interval throwing progression, post-surgery. So like I said, our 2 speakers earlier today did a really good job at describing the interval throwing program. I just want to kind of talk to you guys about how we can prep them in the weight room going forward. First thing, communication, daily communication. Asking the question, what can't the athlete do? And whatever they can't do, everything else is fair game. Making sure that we're consistently checking in with the medical staff, as well as staying on top of physician protocols. I have a really good relationship with our minor league rehab coordinator, Kevin Orlowski, and director of player health, Ron Porterfield. And we're able to have a unique relationship where we can share like-minded problem-solving ideas as a group, find the best plan of care for the individual going forward. Communicating with them, avoiding doubling up on different aspects, and making sure that we're covering all aspects of the rehab setting. And then how is the athlete responding? And then how is the athlete, how are they changing, or is there any setbacks that we need to be aware of day to day, week to week, month to month? Looking at their individual profile, what are the needs of the athlete? What can we do to improve from an able standpoint? Brandon McDaniel talked a lot about this last week. How can we find the weakness in their profile that initially created the inefficient movement pattern and attack it head on, whether it be from a movement standpoint, performance nutrition, general fitness, performance skill, energy system, or movement skills we try to do within our different screens that we administer during spring training and throughout the season. The overall goal is to progress the athlete to a higher level of fitness before the start of the interval throwing program, and making sure that their movement competency no longer is their limiting factor. This is really important for us. That way, when they start the return to throwing progression or their interval throwing program, they're able to produce and absorb new force or stress than prior to injury, while maintaining torque or minimizing torque and strain on the newly repaired body part. Upper body lifting, kind of general rules of thumb that we go by. Check and see again what movements are not able. Movements that are important to us, things like pushing, pulling, vertical horizontal planes, sagittal, frontal, transverse, open chain, closed chain, carrying. Focus on movement quality, making sure we're teaching, emphasizing, and demanding proper movement. Making sure that we're going through full protraction, retraction of the scaps, and making sure that we're not glued down into one position, which can in the future possibly create more dysfunction. A lot of focus on serratus and low trap work on there as well, and make sure we're mastering the sagittal plane activity before frontal and transverse. We always start with open chain type of movements. That way we're not in a fixed position, putting more stress possibly on that surgically repaired joint. and progressive weight is tolerated. So one thing that we kind of go by is making sure that we always hold or carry 5 pounds more than what's being used within a full range of motion. An example would be if we're doing a farmer's carry of 20 pounds, we might be doing a half kneeling one arm cable row with 15 pounds. This will help us prep the arm with neurological and local tissue tolerance before diving into full range movements. And then making sure we're always kind of tracking total volume, total number of sets, total number of reps, how many exercises the player and will be holding. General rule of the thumb for holding on exercises, we always start with just holding weight with their primary exercises. And then we'll add in secondary, tertiary, and auxiliary holding. When deemed ready, we'll use things like cuff weights and or ankle straps around the wrist to help add a little bit of weight if deemed appropriate for that specific exercise. Some of the principles, making sure that all our movements are balanced, pulls and pushes, unilateral, bilateral, making sure that we're owning all phases of the strength continuum, all the way from endurance, mobility, stability, proprioception, all the way down to number 5 in power. And then making sure that we're always touching and working on low threshold, high threshold, and fatigue state type of training. Both prior speakers kind of talked about a lot about percentages and reduced effort throwing. I think this is a really good spot where we can teach these overall total body reduced efforts in a more controlled type environment. Kind of identify the low threshold strategy as a non-fatiguing, more parasympathetically driven exercise that have more to do with posture and motor control. Low force, low threshold, and usually less than about 40% voluntary muscle contraction. An example of that would be bear crawl. A high threshold is more fatiguing and emphasis on force production. More prime mover dominant with high load, high force, high velocity, and more than 40% voluntary muscle contraction. Example would be like an alternating arm dumbbell bench press. And the fatigue state training would be training past the line of physiological replenishment, doing something like a contrast where doing a dumbbell bench press and a med ball chest pass right after, especially for high reps, maybe 10 to 12. This will tax the ATP, PC energy system, so the body has to tap into another energy system to complete the given task. Once we get to the interval throwing program and starting to rebuild past specific number of throws and intensities, the body starts fatiguing. So have we trained them good enough in the controlled setting in order to maintain proper mechanics or proper movement patterns during their throwing program. Now we're going to get in kind of the phases, how we're going to go. Starting out with the duration. For this specific talk, I kind of used what we do for a duration or week standpoint from a Tommy John rehab. The specific weeks can be changed according to the type of surgery, if it's a shorter duration, a longer duration, but we always use to try to go through all these phases and making sure that we're touching every aspect of the strength continuum prior to the throwing program. So phase 1, the duration is usually 1 to 8 weeks after suture removal, making sure we're modifying per physician specific protocols and communicating with our medical staff as well. These are going to be more neurological patterning, kind of use of the dynamic systems theory. Brandon, again, talked about a lot about last week, so we won't dive too deep into that, but using constraints and body positioning to positively influence the production of a specific movement, and then challenge the body to get into new positions while creating new motor skills. The way we kind of relate it is getting back to earth and more primal patterns. Here we'll be regressed into different body positions like prone, supine, side lying, quadruped, bear, tall kneeling, and half kneeling to use as constraints. For me, these primal patterns have hit close to home over the last year. We have a 15-month-old at home, so it's been fun to kind of see his hit his motor milestones, and then how we can almost relate what he's doing to our athletes at work as well. Methods, we're looking to be in more push-pull type splits 4 times a week. We'll use everything from isometric holds, tempos, time under tension, oscillations. Will be more moderate to high reps and low intensities. Phase 2 duration will be about 9 to 13 weeks. We're going for more motor unit development, more of a strength endurance. We're looking to reinforce new patterning and hold it positionally. Increasing the use of gravity and total number of joints. We'll start to introduce split stance, base, one leg type exercises to increase the difficulty. And then external stimulus will go up, and we'll start moving into kind of closed chain full range exercises. Some exercises in this group would probably be more like push-ups, one arm, one leg rows, hips off, bottom up kettlebell bench, rotational lat pull downs. And then methods would be still with a push-pull split 4 times a week, more hypertrophy type qualities, a lot of the same tempo, time under tension, a little bit of decreased overall time, use of some pyramid straight sets with increased total volume and increased intensity. Okay, getting into phase 3, going for a duration of about 14 to 17 weeks. We're looking for overall force production here. Or strength, continued reinforcement and reloading over our new range of motion and patterning. This is going to be more traditional strength training in nature. And we're prepping the body to begin 2-arm upper body plyometrics coming up in phase 4 by increasing the overall motor unit recruitment. And at this point, the athlete could be holding or moving up to 70 pounds or more in each arm. And we're not going to prescribe or introduce any new exercise to the player that's not comfortable with it or doesn't fit into their movement profile, as each player kind of reacts differently, especially in this phase 3 or more of a max strength type load with their upper body lifting. But we will make the appropriate modifications in order to keep their program as close to the attributes of this phase as possible. That way, again, we can continue to prep their body the best we can moving forward for that interval throwing program. Exercises can include like alternating arm bench press, 1 arm, 1 leg rows, or 1 arm, 2 leg rows, lat pull downs, not limited, and there's plenty more that can fit in there. Methods will move to a upper lower split. We'll go, we can use some tendo units to kind of track and see what the velocity is if we're moving too fast, if we're not getting the strength qualities that we're looking for. Straight sets, get into some clusters, a little bit of that fatigue training we're talking about, more eccentric in nature, supported body positions on benches, chest supported rows, lower reps relative to the prior phases, high sets and higher intensity as well. Phase 4, now we're getting into weeks more of 8 to 21. And we're talking about rate of force development or power. We're reloading and loading on higher velocities through new ranges of motion and patternings. In this phase, we'll use med balls, Kaiser machines, tendo units, bands to monitor and perform these exercises at a higher rate of speed. Things like seated or speed cable presses, banded lat pull downs, and percentage-based dumbbell lifts for speed with the tendo units will kind of give us a good idea again of are we reaching the qualities in more controlled environment. And then we'll also begin our 2-arm med ball specific upper body plyometric program. And methods will be upper lower splits for a week, more strength, speed, strength, contrasting, French contrasting, low reps, high sets, and a high rest here as well. One thing to note is our upper body lifting days will always coincide with our highest intensity plyometric days or before an off day. That way we're not taxing that upper body, not getting prior or proper recovery before that high intensity upper body med ball plyo day. And then phase 5, kind of our last phase before we get into the interval throwing program. This will be weeks 22 to 24. More work capacity in nature, so we can see the ability to express all our prior qualities in a fatigue strategy over a specific quantity of time. We'll transition to one arm and transverse plane medicine ball plyometrics. Again, our highest demanding lift days will coincide with the highest intensity plyometric days or before an off day. We'll also introduce unilateral throwing type modalities. This is a case-by-case basis. Things that we do use are Indian clubs and footballs. We use for shortening arm strokes, reduce early pronation, arm conditioning, many other things as well. Plyo balls, not everybody does them, and if they do them, everybody does not do the same program. We use them for a wide range of reasons, such as general warm-up routines, velo development, arm conditioning, force acceptance, and adaptations for specific movement patterns that we're trying to create, especially specific to the throwing. And then lastly, sock throws. These are to help build throwing confidence inside before going out on the field. There's really no end result to where the ball is traveling because it's getting stopped in the end of a sandy sock. So that the player can just focus more on the movement or the throwing aspect and not really what the result is if they're hitting their partner in the chest or they're overthrowing it and hitting the window and behind them or whatnot. And it also helps pattern full retraction and extension and posterior chain deceleration of the shoulder, lat, all that upper body musculature. Methods here will be total body splits 4 days a week, and then all applies from all prior phases. As we go through these phases, if we've already gone through the phase, we will continue to use those type of exercises or those principles, especially in the tertiary and or auxiliary blocks of our lift. That way we're continuously working on our low threshold strategies from phase 1 and 2 and our more high threshold from phase 3 and 4. Getting into plyometrics. So upper body plyometrics, we're always going to work from the ground up. We're going to start in kneeling position, kind of like we talked about in phase 1, and then we're going to get to standing and single leg exercises here as well. More general throws, so like a kneeling med ball slam to something more specific, drill and skill type blending, like a step behind with a rotational overhead throw. Starting bilateral and then the sagittal plane and moving more unilateral, frontal, and transverse as we progress along. I was starting in a non-counter movement position, so prepping the body, getting rid of that muscle slack before we go, and more concentric in nature, getting into counter movement exercises where we're going to go from an eccentric load to a concentric movement, and then continuous, seeing how we can repeat over time, and again, more of a fatigue threshold standpoint. Going from dead ball, the big fluffy guys, the Dynamax balls, more concentric, into reactive ball, more concentric to eccentric, again, working on that force acceptance so that when they get out and throw, the deceleration pattern. And then working from heavy, we start with heavy because it's self-limiting due to the reduced speed of movement. Usually start around 10 to 12 pounds. Into light balls, we'll start the light once a general rate of force production has been built in the weight room with our more controlled exercises in phase 3 and phase 4. We'll use 4 pounds all the way down to a basketball. And then contrast, we'll get into more heavy light, try to produce force and then try to replicate that same force at a greater rate of force production. And then finally, once we start our interval throwing program, kind of start to finish of that program for that specific individual, we'll kind of look at an undulated training program what areas do they need to focus on, more on deciding factors, training age, movement screens, baseball screens, performance testing. We kind of travel back to square one and reevaluate the athlete to find what their new focus of the program should be, and then see how they've progressed over those 24 weeks from more of a linear progression standpoint, and really focused on building the foundation of the house before we're worried about creating a bigger engine. And then depending if they have more general fitness, need more general fitness or movement specific development, our upper body lifting days will always be on our highest intensity throwing days. And then we will start their specific concentrated routine once their bullpen progression is started. So if they're a starter, if they're a reliever, we'll get them on kind of a mock 5 day if they're a starter, or a mock 6 day, due to the 7 days a week and usually having an off day on the 7th day. And kind of looking to continually build volume, especially early on once they start the bullpen progression, while maintaining movement quality. That way we can create a higher workload thumbprint in preparation for the future demands of the game. And then, yeah, that's what I got.
Great. We've got everybody back for the question and answer thing. I just want to make one comment as I was listening to Stoney talk. Strength and conditioning really has, for lack of a better word, got their act together in regards to, I was so impressed with the fact that as he was going through the programs, they were stepwise, there were really scientific reasons why they were moving from one to the other. Didn't jump around, didn't do anything. We heard this from Brandon McDaniel last week, and doing this stuff. And sometimes, and maybe some people in the audience will want to comment on this, but I want to hear Christopher's idea of this in regards to watching throwing programs, interval throwing programs on, let's just say UCL, because it's the easiest thing to talk about. It's sort of written down generally. A lot of times they're still using perceived effort, which we've shown over and over not to be reliable. It's sort of like going in the weight room and saying, how much am I lifting today? Well, I don't know. It could be 70, it could be 80, it could be 50 in our throwing programs. And seems to be that we should be more stepwise on all that. Christopher, what do you think on that particular issue?
Yeah, I agree completely. And I think that that's something that we still have to sort out. And so, right now we've taken a stepwise approach in terms of number of throws, increasing distance, those types of things, but it really needs to be based sort of on stress and workload. And it's got to be the same approach. If you're trying to get somebody to where they can squat 300 pounds and they're starting only able to squat 150, you're going to develop a program, to help get them to that specific goal. We should do the same thing out on the field. And part of it is, a guy before he got injured could squat 300 pounds. So what you're trying to get him back to. I would argue on the throwing side of things, we don't always do a good job of knowing exactly what we're trying to get them back to either.
Glenn, here's my question, and it's a really simple question, but almost impossible to answer. And that is, why do we go out to past 150 feet? Why is it that people are throwing 300 feet? Is there any science behind that type of long toss program in regards to increasing velocity or doing anything positive from a scientific standpoint? We know that players all say it feels good, it stretches me out, all those kind of things. But is there any science or any papers written in regards to actually improving performance and or velocity with just long toss?
Okay, well, the quick answer is why people go far the distance is because of testosterone, and it's macho to throw as far as you can. So that's why, but people do it. But the question you're really asking is it valuable? And I think what we're showing is it's actually putting more external rotation on your shoulder and more torque on your elbow and shoulder. So the question is, do you want to do exercises that are actually overloading? Someone asked a question on the chat, do we want to do exercises that are more stressful than pitching? I personally don't think so. If you want to train a baseball batter or a swimmer or a basketball player, and you want to overload them and push them farther, I think it's a good idea. But half the baseball pitchers are having surgery, so I personally don't think it's worth doing exercises such as maximum distance long toss that are overloading. Again, I want to say also, sorry, for the pitchers. For the position players, they're not filling up the surgery rooms. So if there are exercises such as long toss that are overloading the position players, I'd be more willing to do that than the pitchers.
Christopher, you've probably done more stuff on wearables than a lot of people. What are you recommending to the Minnesota Twins in regards to a throwing program and monitoring? Are you using Motus Sleeve? You're using perceived exertion? You're using radar guns? Rapsodo? What are you using?
Yeah, the easy answer there is yes. I think we're still sorting it out. We're looking at everything, to be honest with you. Obviously, the different technologies all have their own pros and cons. We do have some concerns with validity of a lot of these different technologies. So, a lot of things we're doing now is trying to determine and assess which of these are valid, which ones are not, which ones are reliable, which ones are not, and then sort of figuring out how you can use them. Because we may find that some of them are reliable, meaning they will give you consistent information, but it's not valid. That information is not necessarily correct. And so there may still be some value in using that as a reliability tool, but not necessarily a validity tool. So we're doing a lot to sort of figure out what's good, what's not. The other thing, though, is in a lot of that data that I showed shows that within a single player or pitcher, they tend to be relatively consistent over time. So, or at least when you make them throw, the same type of throw under the same conditions. So it may be that we don't have to track every single throw that they make, but we need to know what player X does at 90 feet, 120, 150, and on the mound, and then use that to sort of build a program. So we haven't committed to any one thing. We're sort of looking at all of these as different avenues, different possibilities, thinking about it from a lot of different ways. And the other thing we're doing too is really working on, getting everybody involved, like you have with this conference. It's not just the therapist, it's the therapist plus the athletic trainer, plus the strength and conditioning and pitching coach, and trying to get everybody to look at this thing and try to put our collective minds together and figure it out. But to be honest with you, it's going to be a while, Stan. If I referenced using the ACL, the return to play testing and functional testing that we do for the ACL. We've been at that now for 10 to 15 years. We're way better off than we were 15 years ago, but it's still not perfect. We're still tweaking it. So it's not like we're not gonna figure this thing out overnight. It's gonna take us a little while, but we need to do it.
Okay, Nancy, I see Alan Chase has got his hand raised. Can you open him up and see what he wants to ask?
Yes, go ahead.
He's on mute. He's on mute still.
Okay, he's got to unmute himself. He's allowed to talk. Alan, are you there?
There he is.
Yeah, I'm here. Sorry about that. That was an accident.
Alan, what's your question?
I think you were saying the hand raise was an accident. So
Oh, okay. I'm sorry. Okay. Let's go to some of the questions on the Q&A, Nance.
All right. First one, how would you approach a setback during an interval throwing program?
Yeah, I think
first of all, I'd say avoid it. Avoid the avoid the setback. And just along those lines, a lot of times pushing the throwing program too much or using perceived exertion is one of the ways to create a setback. There was a good article out a couple years ago in regards to medial elbow pain during a rehab of UCL. I think Keller wrote it, and basically he said that if you had a setback or you had pain in the medial elbow during rehab, which usually occurred about 9.5 months, that you would end up, you had a 20% chance of another elbow surgery in the future. So, and the people who did not have a setback only had like a 7% chance of having a second surgery. Christopher, did you?
Yeah, I think and Stan and I are currently wrapping up a study looking at that actually, and they happen. And it's about 20 to 30% of players report some form of setback that causes them to either take a pause or step back from rehab. So I think one of the biggest things you have to do is prepare for it ahead of time. Just like Stan said, do everything you can to avoid it, but also sort of, you think about it, make sure your team is aware about it, and then catch it early. That's the biggest key. And oftentimes if you have a small problem, you catch it early, you stop and take a break, it stays a small problem. Oftentimes the trouble is when you try to push through it, then it becomes a big problem and it lasts a lot longer. So I think the keys are prepare for it, catch it early, try to avoid it.
Nancy?
All right, next question for Dr. Camp. Which upper extremity functional tests do you suggest for return to play for throwers? Do you think those are more informative than throwing as a standalone test?
Yeah, that's a great question. And the answer there is we don't know yet. And similar to the ACL, it will probably need to be a battery of tests. And I do think throwing is obviously one key component, but it's going to be other things too. So throwing is just one piece of the puzzle. So there will be other things, looking at balance and proprioception and strength. So we need to sort of look at this from every perspective. And psychological readiness, that's gained a lot of press here recently for the ACL. Probably the same. I mean, you guys, baseball is a very mental sport too. So I think that's a component. So a good functional sort of return to play test is going to have to be multifaceted. It's going to have to cover all of those, and it's going to have to be validated. So those are sort of the keys. So there is no one test. It will be a battery of tests.
Stoney, what kind of things do you guys do preseason in regards to testing in general?
We do kind of a modified FMS. We run through some TPI screening, and then on the minor league side, we have some plyometric with med balls, and we have some weighted exercises at about 85% of the body weight that we use. So that way we do have a low threshold and a high threshold exercise and similar movement patterns that we can see. So like the inline lunge on the FMS in a weighted split squat, and we can see where possibly they might be breaking down in the chain, where some people might be able to do the inline lunge really well in the FMS, but once you add a little bit of greater force production or speed of movement, it breaks the chain, as well as you also see guys that are really good because they've been doing weighted exercises their whole life, and the weight is actually moving them instead of them moving the weight. So once you get rid of the weight, the inline lunge might be bad as well. And all these movement patterns are things that we see either in the weight room at least once or twice a week, or out on the field when they're performing their activity as well. So there's some subjective viewing that we do get to see, as Dr. Camp talked about, from an observation standpoint, where every day is kind of an evaluation, and every day we can see if they're progressing, regressing, or staying the same, and all the different type of movement patterns that we look for.
Nancy?
All right, next one. Looking at the research presented from the first two presentations, the study populations were healthy individuals. Specifically, with the participants' perceived effort, would you expect to find a difference with an unhealthy population from your findings?
Okay, I'll say I don't know the answer to that. I think it's a really good question. We have not studied any injured population. We've just set the baseline based on the healthies. So I don't really know. Maybe Chris does, but my best guess is it's the right baseline. This is what you want to be, and that 75% effort is like 80 or 90% actual velocity. I guess the injured people would have the same targets.
Yeah, I think it's a good question. It's probably one we'll never be able to answer. It's very, very hard to do testing and research on injured patient populations for obvious reasons. One of the things I would be concerned, I don't know how the effort thing would play out, but I would be concerned with the variability. I don't know for sure, but I would anticipate you would probably see greater variability in an injured population as opposed to a healthy population, because they're all injured to different degrees in different locations. And so that would be my main concern, is actually seeing increased variability in that group.
Glenn, just a quick question on something you presented with a long toss over 150 feet. You started to see increased external rotation, torque up to 100 Newton meters. We see this, the same thing that we're hearing, and some studies are starting. The Reynolds study talks about weighted balls, increase in external rotation, which may increase instability. What's your thoughts on that fact that increased external rotation when you get after 150 feet in a long toss?
Yeah, so obviously that's a lead-in for next week when we talk about those issues in weighted balls. But for the very reason you just said, I don't think I want to go past 150 feet of online throwing, because I don't think I want to have the pitchers have more torque on their elbow, and I don't think I want them to have more external rotation than their pitching external rotation. I think pitchers are at the red line already. When you're pitching 100%, it's pushing your body to the limit. I don't think we want to overexert pitchers beyond actual pitching.
Christopher?
Yeah, I agree too. And one of the questions earlier was, should you push them past that red line beyond what they're capable of? And that's sort of what some of the guiding principles are behind a lot of these different get velocity quick schemes. That you guys all know the programs that are out there trying to get players velocity fast. And one of the things that I worry about, and I think what Glenn's alluding to here, is that you're giving somebody increased velocity, but you haven't given them the time or the chance to build the foundation underneath them to be able to handle that velocity. So you're working on the end of the kinetic chain to try to get a quick fix and add 3 or 4 miles per hour, but you haven't addressed mechanical issues, flaws, weakness throughout the rest of the body. And so a lot of that force ends up at the shoulder and the elbow. So it's a couple of analogies. One, it's sort of like shooting a cannon out of a canoe. Not smart to do because you don't have a good foundation. Or it's maybe the same thing with why lottery winners very commonly go bankrupt. All of a sudden they're given a ton of money. They've never had the chance to learn how to manage it and how to take care of it, and it's a tall task to ask of them. I think it's the same thing with giving somebody velocity very quickly. They're probably, the rest of their body is not prepared to handle that too. So I think that's one of the dangers that you run into by pushing the red line here and working on sort of the end goal of just velocity, not addressing the rest of the kinetic chain.
Nancy, we got a bunch of questions on our Q&A.
Yeah, let's go to Stony. When you have 4 times splits per week with an athlete, how do you manage this when guys are getting into the later stages of their throwing program? Do you make any changes to your program volume to ensure players are fresh for their throwing programs? Does your frequency change during the BP phase of the throwing program?
Yeah, so for the first part of the question, we still stick with the 4 time a week kind of total body splits when we get into our phase 5 and the beginning, where we will start to create low and high threshold days, and we'll use the low threshold days on the day prior to the high intensity throwing program, so that they are fresh. Again, more of a phase 1, phase 2 type of lifting program, more postural realignment, activation type exercises, and then we'll always kind of stack our intensities and our volume with the higher intensity throwing days. And then once they do get into lab EPs, again, once we backtrack into, once they start their bullpen progression, we'll throw them on what their specific routine is, whether they're a reliever and they do a 2 time a week total body, or they do a 4 time a week push pull or upper body split. We'll throw them back on their specific routine. But again, the upper body, the high intensity upper body day, or just the high intensity day in general, will always be on the high intensity throwing day. So, but right away after we start bullpens, we'll usually do the lift the day after. That way we can see after they come in the next day from throwing their bullpen or their live EP, see if they're asymptomatic or symptomatic. That way we reduce the risk of layering too many things. And then if we layer too many things, we can't really pinpoint what aspect, was it the lift, was it the live BP, what stress was it that created, you know, soreness, fatigue, or some sort of setback as well.
Nancy?
All right, we got a question for Dr. Camp and Dr. Fleisig. Why does the throwing program literature focus on using percent perceived exertion as the common way to monitor effort in throwing versus other methods with more evidence and support, such as rating of perceived exertion scales, CR10, CR100, etc.?
I think when, again, maybe Stan or Chris know, but when Kevin set it up, he just, I think the important thing is the interval throwing program is science, but it's also art. I think what what Chris and I were presenting here are a lot of quantification about how much torque and velocity when you do these things, but it's a generalized program that you have to customize and individualize with people and get some feedback hands-on. So I think it's a good way to go with perceived effort. And I think you have to, I don't think you can have an exact equation. I think you have to actually do it with the people and see if there's setbacks and move forward.
Yeah, I would agree too. I think historically that's sort of the best that we've had. And also you have to think too, sometimes we live in our major league bubble where we have high-end athletes with, you know, access to great care, great therapists, coaches, and everything else. But the vast majority of these injuries occur in players who are not professional baseball players. So these are high school kids and college kids, and they don't have access to the wearables and the motion capture and everything else. So we have to have something available to the masses that gets us closer, gets us in the ballpark. And I think that's sort of where things started. That doesn't mean we shouldn't continue to involve and improve them, but that's sort of where we started. It works for large groups, but we got to figure out how to take a more scientific approach, not only professional, but also at the lower levels as well.
Well, let me go on the other side of that. I've been pretty vocal about perceived exertion as a method for failure. We've got overall 5 or 6 real recent studies that show perceived exertion does not equal actual amount of velocity. Now, there is a little disconnect, as Dr. Camp talked about, in regards to perceived exertion or radar gun velocity and actual torque, but it's pretty darn close. So to Christopher's thing about being a little bit more scientific, maybe we can't take a big jump, we can take a small jump, especially at the high school and college level, where wearables are not necessarily available, especially after Division I. And I think using that in regards to being able to determine the weight on the barbell that you're lifting. And I think there's a bunch of different programs that you can actually work with using the radar gun once you've taught. I think this is the part that is lost, and I'll go with Glenn's idea of art, is you have to be able to teach the person to throw at a miles per hour. And it's relatively easy when you start playing with a radar gun. And I'm using a radar gun because it's easily available, it's not really expensive, and it's really easy to educate someone to throw at 50 miles per hour. This was sort of talked about by Kevin Wilk last week, but I think once you do that, we have programs that just sort of progress. We don't have different programs like you do in weightlifting where you have a recovery day where you do lift weights, but you lift them at lighter weights and less sets. We do throwing at times where we say, okay, if you're throwing at 70 miles an hour for 30, 35 throws, that's just as an example, tomorrow we're going to throw at 60 miles per hour, but we're going to throw 45 throws. And once you're able to do that from a biofeedback standpoint, it is really easy to keep them within 2 miles per hour of what you want. With the caveat that as you get higher in velocity, the torque may increase relative to the velocity. But the art part of that, to go to Glenn's point, is really the mechanics while you're doing that. You have to teach them to throw with good mechanics from the first time you throw. I think at the professional level, we should be looking at wearables and more highly scientific and doing the studies to show that they're reliable and able to be used. But at the grassroots level, to use just perceived exertion to tell someone that all they need to do is throw at 70% or 50%, we know that's wrong. And we know they're putting more torque than we want to put on that maturing graph.
Stan, I just want to say one last thing about that. I don't think it's wrong. I don't think percent exertion and velocity are the same. We've shown that. But the program was designed to do 50% effort and 75% effort. It wasn't designed to do 50% torque. It was designed, so I think it works well. I don't think the velocity has to be the same percentage as the effort, and I don't think torque has to be. I don't think the program is designed to do 75% torque. It's 75% effort. So I think it works how it is.
Well, there's no question it works. It's 83% success rate, but the question is, can we do better?
Yeah.
Chris?
Yeah, I would agree. I think that you do see a decrease in torque with reduced effort. It's just not proportional to the effort decrease. So you just need to know what the numbers are. You know, right. So if you want a 15% decrease in elbow torque, then you better tell them to decrease 50% effort. Don't tell them to reduce 15% effort. That's all. You just got to sort of know what the numbers are.
Nancy, we got maybe two more questions as we're getting a little bit later. Maybe two more questions, Nancy.
All right. We often see interval throwing programs written out with only distances and volume of throws prescribed. If we can accurately gauge intensity with, you know, radar gun, etc., could someone talk me through how they would ideally might see program intensity within the whole throwing program?
Well, this is what I do. We progress when we increase the weight, if you will. I like the weight training analogy. We increase 5 miles per hour, and we typically will go 2 to 3 weeks with the velocity. I do not do distance. I don't care about distance. I care about 60 feet 6 inches. Now, this is specific to the pitchers, not the position players, but I use them always online, and I'm always monitoring them from a velocity standpoint to stay within those ranges. And then I decide on what we're going to do for the week, just like you would in a strength and conditioning program, saying we're going to have these heavy days, these lighter days, these are recovery days. And once we set up the program specific for that player, then we will stick with that thing depending on how we change the intensity. So this is like throwing a bullpen every day at max effort. You wouldn't do that, and you wouldn't do that in a weight room. So we know where it's safe. Because as we throw, we monitor their symptoms. If all of a sudden you get to 65 miles per hour and people are having a little bit of tightness, we back them down to 60 where they're having no pain. So we can work on some endurance. We can work on some power too once we want to increase. So we progress that way. I don't ever go past 90 feet because I just can't see the reason why. You know, there are people who like to do long toss. I understand that. I don't stop them from doing it, but I try to explain what we're trying to do in regards to returning them to the mound. So that's kind of how I work it. Nancy, another one?
All right. This question for Stoney. Do you use PRI breathing or any type of breathing exercises for postural realignment? If yes, how do you implement it in your training phases?
So most of our PRI breathing stuff is done in the training room, as our medical staff incorporates that into their program over there. But with our communication, we're aware of what they do and aware of what pattern they're in. And so if they come over and say that they're in a left AIC or a PEC pattern, we know what they're talking about, and we're able to adapt their specific training program to what limitations or restrictions they may have, whether you know, there's a low trap deficiency or an oblique that's turned off that they're trying to get back on, or they're stuck in extreme anterior tilt. So we do more from a practical standpoint. In the weight room, we do incorporate some of the DNS type breathing, diaphragmatic breathing, working on again, ground up, working from lower postures, laying on the ground, especially when they're in a phase 1 type scenario. That way, when we get increased to phase 3 and phase 4, more demanding, less parasympathetically driven breathing, that their body naturally knows how to do it with higher intensity type exercises, which now hopefully with that they'll be able to take out onto the field and keep their stabilizers on until the last second when they need to turn on those big prime movers to help reduce the wasted energy and keep energy consumption high for the long season ahead of them.
Great. I want to thank the speakers. Great stuff. Really high level stuff. I appreciate you taking the time and everything. Love the questions. We got a lot more questions this time. We couldn't actually get to all of them. So we'll try to do better next time in regards to the timing of this stuff. Just wanted to put this on so you know what's happening next week. So we're doing a weighted ball roundtable. This is really after the ASMI format that they did in January. Worked out really, really well. Glenn's going to be back. Eric Cressy, Mike Reinold, Chris Ahmad, and Brandon Erickson, who just published a paper on underweighted balls. We are planning to have someone from Driveline. We're working on that. We think Driveline should be in the audience to be able to talk about that from their perspective. So hopefully we'll be able to get all the people together and talk about weighted balls. It's going to be a different format. Each person is going to present about 5 to 7 minutes of a presentation, and then we're just going to go at a debate on the pros, cons, ups and downs, left and rights of weighted balls. So it's going to be pretty good panel here that I'm excited about. We are going to leave the webinar on, and so you can do the survey. So it'll be on for 5 minutes. All the video and audio will be turned off. Hope to see you here next Wednesday for the weighted ball roundtable. Thank you very much.